United States specialists are partnering with the Seventh-day Adventist Community Hospital with plans to bring state-of-the-art care in areas of cancer and cardiology. The community hospital hopes that it would serve to better fill any gaps in the public healthcare system. Alicia Boucher has more in this report.
The community hospital of the Seventh-day Adventists is 61 years and was relaunched last week. According to its Chief Executive Officer, Dr. Stephen Carroll, the hospital was first opened to supplement the public healthcare system, and he tells us that purpose has not changed.
Wherever there are gaps in the system where the government has challenges, community hospital as a private institution is willing to step in. We have done some of it already. We've already worked with the ministry. If there's an equipment issue, we will fill in the gap and provide, let's say, CAT scan services.
Dr. Carroll states that it extends to several other areas as well. But now the hospital has a vision that will incorporate what it calls state-of-the-art healthcare in cancer and cardiology. As such, it has enlisted the services of 2 specialists out of the United States. They are Trinidadian-born cardiothoracic surgeon Dr. Daniel Beckles, who is also the founder of Advanced Health Lung and Surgical Limited.
Getting things set up, the infrastructure, the process, I think that's going to be the first step.
And hematologist-oncologist Dr. Maurice Willis, Chief of Hematology and Oncology at St. Louis University, which has been conducting clinical cancer-related trials. He specializes in treating head, lung, and neck cancers in adults.
State-of-the-art chemotherapy and expertise that we have. Dan and I work together and gave great expertise to people in Texas, and we want to. I'm here at the behest of him because he's from Trinidad. I'm from America, and I want to bring quality to our people.
Dr. Willis is working with the hospital in an advisory capacity, which would factor in training.
In the near future, when we start the cancer program, the intention is that Dr. Willis will be in charge of the cancer program. He will help us set the policies and procedures and protocols.
Both doctors are doing this while maintaining their practice in the U.S.
But I'm always going to be available. We are leveraging technology to work up the patients. The preoperative workup of these patients are going to be extensive, and we have local talent and resources.
Dr. Beckles also performs heart transplants. He notes that kidney transplants are successfully done locally, but he hopes that the donor culture would improve to expand the areas where transplants can be done.
Up to 8 organs can be donated from every single person that have a mishap.
With public health care being free and community hospital being a paid entity, Dr. Carroll tells us the public-private partnership, or what is referred to as outsourcing, can facilitate reduced costs. He sees the need for it as he references a nurse who said at a recent town hall meeting that she was the head of a unit but couldn't get an ECG done on herself. In 2024, Trinbago Progressive Association Incorporated out of the United States, of which Dr. Beckles is a part, would be doing a medical mission, 1 week in Trinidad and 1 week in Tobago, where free healthcare would be provided to people. The community hospital has signaled an intention to host them. Alicia Boucher, TV6 News.